I have heard the call of different groups from the medical community for a 2-week enhanced community quarantine, SEQ, in Mega Manila. I fully understand why your health workers would like to ask for such a timeout period. They have been in the front lines for months and are exhausted. To our health workers, this is a war that you have been trained to fight. This is a profession that you, all of you, and who are educated and trained to face such challenges, you're frontliners in the battle because you are learned in this field. Kung bayaan natin tutulungan, kung walang tutulong rather, sa bansa at ang mga kababayan natin, sino ang maasahan ko? Sino ang maasahan natin na gumawa ng trabahong ito? Huwag kayong mawalaan ng pag-asa. Nakikita at kausap ko ang iba sa inyo. Habaan ninyo lang. You stretch your patience and your not endurance, because you can only also take so much. Your fervor. Haan na lang ninyo yung pasensya ninyo and your fervor na ikaw isang medical tao. At tiwala kami sa inyong kakayahan. We are aware that you are tired, that you have worked almost even beyond 24 hours a day. So ito kasi yung, wala kami matakbuhan. Kayo yung nag-aral. Kayo yung may alam. Na ngayon, kung sabihin ninyo na anong mabuti, and you raise the spectacle of yung ang agony ninyo, you treat it as if you're ready to stop to work. Huwag naman ganun kasi kawawa ang mga kababayan. Sino naman asahan namin? I don't know. I'm sure that that's not into your heart. But from your maybe despair, I would like to tell you that ang ating gobyerno ay hindi mag-iwan ng mga trabahante niya. So to my fellow countrymen, we are doing everything possible to alleviate the situation, to assist our healthcare workers and enhance upgrade our healthcare system. Alam mo kasi, you know, first time nangyari ito eh. And this is not just something like a call to action for a few sick persons, maybe because of the distance or maybe because of the... Ito lahat eh. Wala namang may gusto. Kaya nga si Secretary Duque, gusto nila putulin yung ulo. Ano mang kasalanan niya? Na yung medisina nandyan, buhol-buhol ang trabaho because this is the first time. And hindi ko kinukumpara. You read or you listen to BBC and CNN. Nakita ninyo, America and the rest are far more worse than us. Yan ang problema. But they have the machines, they have the equipment. And yet they are suffering terribly. Almost, hindi ka makapaniwala. So kami dito, hindi namin kayo kinakalimutan. There would not have been no need for you to go into itong ganito and raising your hands as if sabihin ninyo revolution. Now, if you think that this can be solved by revolution, then by all means, we start it. Mas gusto ko. Kung magsabi kayo, nagtaas na kayo, revolution, go ahead. Because I would be calling all people who love their country to come forward and work with the people. Yung mga health workers na hindi connected sa gobyerno, we will try to help. But that there is no need for you and for the guys, ng 1,000 of you, telling us what to do publicly. You could have just wrote us a letter. Lahat naman ng sinasabi ninyo, sinusunod namin. You know, it's the resources. Ang pera, may gusto kayong bilhin ko. Ang problema, ang bulsa ko, butas na yung isa. Dahil we have suffered economically, pati individually, yung income ninyo, wala na. Hindi lang man kayo. But to go almost on a, not really a rampage, but an outrage, parang galit at mag-revolution. So huwag naman ganun kasi alam ninyo nagtatrabaho kaming lahat. Kung yan lang ang makaya ng pera natin, hindi hanggang dyan lang tayo. Hindi naman kami nabuti, nakaupo lang dyan, nandyan yung pera, hindi naman pinapagalaw. Everybody's trying. Kaya nga, yung mga iba-ibang modalities na lang how the vaccine, if ever mabigay, mag-abot sa atin. Well, next time, you can just ask for an audience. Pero huwag ho kayong magsigaw-sigaw, revolusyon. Alam mo, sa totoo ko, alam niyo, hindi ako kilala talaga. Magsabi kayo revolusyon, then, ngayon na. Go ahead. Try it. Sirain natin itong patayin natin lahat ng COVID. Is that what you want? We can always end our existence in this manner. Hindi naman kayo na natatakot siguro. Alam namin yun na hindi kami matakot. But to send a message na without giving government a chance. Ngayon, anong gusto ninyo? I will implement other things in this government without informing you. Would you be happy with that? Or if you are really on a rampage, you want a revolution, fine, let's start it. Go ahead. Go ahead in the streets and the store. Makita natin. Then we will need almost all building, all hospitals there. Hindi lang COVID. Hindi ko, I'm not threatening. Pero gusto ko lang subukan ninyo. I dare you, do it. At makita tayo kung those who want to work with government, lahat ng mga nurses na police, pumasok kayo sa police kasi malaki ang sweldo. If you remain a nurse outside, you only get about 8, 9, 10. So, it's time to give more to the people. All nurses sa uniform sector will have to work. And we can always ask for volunteers. Then I am asking Secretary Lorenzana to mobilize, call a mobilization of doctors and nurses and those who can help. Kung yan na lang ang maasahan namin, or I might outrightly call for all reservists to work. Yan na lang. ang COVID nandyan, wala namang kasalanan. Ni ikaw, wala kang solusyon eh. What are you bubbling about? What's the solution? Except COVID. I've been frank before with you, still frank until now. And that is also the answer of all leaders of government. Anak ka ng, do not so as to be heard. I don't give if you gather 1,000, 2,000. But bear in mind na kayo mismo, kung ipa-take over ko kayo lahat. Ako ang magbayad sa inyo. Take over ninyo. Tignan ko kung ano ang lagay ninyo. We are not incompetent here because we are not doctors. Kayo ang dapat ang you should do the soul searching, not us. Kami kayong makatulong sana, ito lang kayong ginagawa, kung magreklamo, ikaw naman, what can I do? I've always been praying to God for the vaccine. Alam niya, doktor kayo eh. Huwag na natin dramahin ito ng mga pasulat-sulat. At saka itong mga health workers that I said you are bone weary. Bone weary is an idiom. It's just simply that you are too tired to move. You are beat. Ika nga. Bakit kayo hindi pumunta dito na pera? Hanap tayo ng pera. Secretary Dominguez, mabutit na lang, sabi ko, ang vaccine dumating. Kaya yung prediction, my dire predictions, is that it would usually take, tanungin niyo, kayong mga doktor, 5 years to perfect a vaccine. From the alam ninyo yan. So, do not try to demean government. You are not actually criticizing. You demean by government, your own government, by just going ahead. At saka takutin ng revolusyon. Bayan man natin ito. Gusto ninyo, sirain natin. Start it now. Nari a moment to waste. Ako kung anong klase ibigay ng tatrabaho ako, kung ano ang nasa harap ko, I will react appropriately. Kayong mga nurses, ulitin ko, outside, o workers, maghanap ako ng pera sa Congress. Again, to the health workers, doctors, nurses, not connected with government, we will try to look out for a way. Marami kaming gustong ibigay sa inyo. Insurance, then return 10,000 risk, tabala, across the board yan. Tapos, free accommodation, free transportation, free testing. Siyempre, dapat kayo every 2 days, masakit lang sa, wala bang pantusok na putang ina na hindi. Okay lang yan sa tilaok. Kinakain ko minsan buto yan, tendon ng baka. Pero putang, okay lang po sa ilong na ko, Diyos ko. Kulkugin mo ang putang. Tapos, kayong nasa gobyerno, reservists, we might call for a mobilization. Lahat, my daughter, Inday Sara, Pag ako nag-mobilize, mauna yan. I will specifically point out to her as one of those who will answer the... you cannot even... you have no... You have not that luxury of accepting or not accepting. You remember that you are a reservist, you are subject to martial law. Martial law ka to. Hindi martial law ng gobyerno, martial law ng disiplina. Tsaka yung mga police, mga nurses, they're ready to be deployed. Mga police, advise your workers na yung mga police mo na babae, ibaba ninyo lahat. We will train them for about just 1 or 2 days. We will select a big auditorium, yung PICC. You come here in the morning, free merienda, masarap na pansit, pati tapos merienda, mag-uwi kayo. And we will tell you what to do. Ganon lang yan. Kung mag-resack yung mga magtamad-tamad, then we will tell we will help you with government personnel. And they will work how many hours a day has? 24? I can ask my soldiers to work 28 hours a day. Yung mga sundalo, yung mga pulis. So, we are not actually inutil. Tsaka, next time, as a matter of courtesy, not to me, I don't need it, but to the government, kasi kakastusin natin yung pera ng tao. The next time, huwag niya akong parigin ng revolution. Naku, Diyos ko. Yan ang mas delikado sa COVID. Kaya kung magrevolusyon kayo, you will give me the free ticket to stage a counter-revolution. How I wish you would do it. Mga kababayan ko, tiis na ng kunti. By December nandyan na. Do not go out kasi ihawa ninyo yung mga iba. Kaya matatagalan tayo. Yung nahawakan mo, hawakan niya. Yung rails. Yung sa escalator, pupunta-punta hawak ninyo. Tapos sinawakan na, kung maggano ng kamayan sa mga sipon, tapos balik. Tapos ikaw yung susunod. If you go out, you tend to exactly do what I just told you. Sa jeep, taxi, yung inupuan. Mapahid sa ilong yan kung may sipon, na tapos hawak ng... Wala nang katapusan. So, kindly stay home kung hindi naman talaga importante. And for those who really are working in the government critical public work, we have to go. You have to work. Mayroon na tayong medisina. May medisina tayo. Meron na, di ba, we ask Rizal Coliseum saka itong Iglesia ni Cristo pumayag. Salamat po sa inyo.